20 minutes a general overview of acute heart failure, try and describe a few of the concepts and a few of the major medical kind of therapies that are available in this condition, in order to give the last 3 or 4 speakers in this session a bit more of a chance to update you on some of the more specifics and later and newer developments surrounding this type of scenario. Before I start, I will make a couple of disclosures to you, in that I have worked with a number of companies in this area, in particularly relevant to this talk, Abbott and Orion Pharma, who make a compound called levosimendan. And I know levosimendan is not marketed in the United States, but it is being increasingly used in other parts of the world. So I will touch on it not because I'm recommending it to you at all, but I think we will see more, if you don't see levosimendan, compounds coming out of that class of drugs. And I think it has some interesting actions which we will allude to. I've worked with the European Society of Cardiology and the European Society of Intensive Care Medicine for a few years now, trying to develop the concept of acute heart failure and trying to bring together some definitions, some classifications, and some evidence-based guidelines. And I'm going to allude to some of those kind of concepts in this talk. If you want to look at those kind of guidelines, they're published in the literature 2 years ago in the European Society of Cardiology's journal. They're free online to download and can be accessed, and will describe everything that we're talking about, and I suspect most of the others are going to be speaking about in the next 5 or 10 minutes. Definition: acute heart failure. It should be very simple to define, but I can tell you now, when we put a whole series of cardiologists around the table, it was not as easy to gain consensus as you'd have thought. We defined it as the rapid onset of symptoms and signs secondary to abnormal cardiac function. It's important to recognize that the cardiac dysfunction can be related to both systolic or diastolic dysfunction, and perhaps some of these kind of concepts will be coming out in the next couple of hours. But it can also be related to abnormalities in cardiac rhythm, or even preload and afterload mismatches. It's imperative to realize that it's a life-threatening emergency scenario, requires urgent treatment, and carries with it a significant burden of complications and a poor outcome. Over this talk, I'm going to present to you some data that's been taken from a number of registries that are available in the literature. These aren't randomized controlled trials. These are observational registries of everyday clinical practice. So they give us a feel, they give us a taste of actually what's happening, rather than giving us specific data to direct our therapies. This is data from almost 200,000 patients taken from a number of these registries to try and give us a feel, a sense, or a taste of the types of patients we're talking about. I think it's fair to say that most of these patients are going to be elderly, predominantly female, and with a significant burden of comorbidities. 60% will have coronary artery disease, 70% will be hypertensive, 40% will be having diabetes mellitus as well. To put that into a kind of perspective, a 40% prevalence of diabetes is 6 or 7 times the normal rate in the US population. So it's a group of patients with a number of other problems coexisting or perhaps causing their heart failure. They'll often be presenting with atrial fibrillation. Quite a significant number of them will have renal abnormalities or renal dysfunction, which will significantly worsen their likely prognosis. It's also recognized, and this is also important to recognize, that perhaps in intensive care we see a specific group of these patients. Most of them actually present with a normal blood pressure or even in a hypertensive scenario. Only a small, perhaps 5% group of these will present hypotensive. And I know in my practice, that's the group that I get referred, and I tend to see far more commonly than some of the others. But the hypotensive, hypoperfusing group is perhaps a smaller subgroup than you'd see if you were sitting in the emergency department. We tried to devise or delineate a whole series of clinical scenarios or clinical presentations to help us get a kind of feel for these patients, because acute heart failure is effectively a syndrome. It's a syndrome of different clinical presentations.